and we're talking about the effects of the virus on the air travel and what they see. In a certain way, you could say that the borders are automatically shut down without having to say shut down. I mean, they're to a certain extent automatically shut down, but it's affecting the airline business as it would, and a lot of people are staying in our country and they're shopping and using our hotels in this country. So from that standpoint, I think probably there's a positive impact, but there's also an impact on overseas travel, which will be fairly substantial. And Mike, maybe I'll let you give a little briefing as to what we just discussed.
Thank you, Mr. President, and grateful to have the opportunity to meet with the leaders of our airline industry today. You know, Mr. President, you said from early on that we were going to have a whole-of-government approach, but the truth is, as evidenced by all these great industry leaders, it's really a whole-of-America approach.
Right.
The American people deserve to know that, according to all of our experts, the risk to the average American of contracting the coronavirus remains low. And that's largely owing to your decision, Mr. President, to suspend all travel from China into the United States and to quarantine all Americans that are returning. It's also owing to the tremendous cooperation of this industry, the airline industry, because in addition to suspending travel from China, you recently made the decision to designate as do not travel certain areas of Italy, certain areas of South Korea. But we also, at your direction, worked with this industry so that now, as of yesterday morning, all passengers on all direct flights from all airports in Italy or South Korea are being screened on multiple times before they board any of these airlines. We're grateful for that, Mr. President. I know you are. Everyone here should know that we're going to continue to follow the facts and the data. Dr. Birx is working closely with all of our health officials to determine what additional screening might be required in the United States or in partners around the world. But our airlines are going to play a key role, Mr. President, in preventing the spread of this disease. And even earlier today, at your direction, we met with leaders of our nursing home industry to talk about the measures, increased measures to prevent the spread of infectious disease. We've sent new guidance out to nursing homes. We'll be announcing later today a new priority of inspections for infectious diseases. We're detailing that. We explained it to the industry today. And also on the issue of testing, Mr. President, you've made that a priority. We'll have over 1 million tests in the field today. I spoke to several governors this morning that were grateful for the fact that the changes you made this weekend through the FDA now make it possible for state health clinics as well as universities around the country to be able to conduct coronavirus tests. But we'll also be meeting this afternoon with leaders of our commercial laboratories to make coronavirus tests more rapidly, more widely available for doctors' offices and medical clinics and consumers around the country. So, Mr. President, as you said, it is a whole-of-government approach, but in a very real sense, it's a whole-of-America approach. And I've already expressed, and I know you feel, a great deal of gratitude to our partners in industry and in the airline industry for acting on your priority to put the safety, health of the American people first.
Good, Mike. Thank you very much. I just want to add, if I might, and to go a little bit further, the Obama administration made a decision on testing that turned out to be very detrimental to what we're doing, and we undid that decision a few days ago so that the testing can take place in a much more accurate and rapid fashion. That was a decision we disagreed with. I don't think we would have made it, but for some reason it was made, but we've undone that decision. Also, when people come in from certain areas, we're doing checks not only at the site of takeoff, but at the site of landing. So when they land in our country, we'll also do, that's if the planes are leaving from certain destinations. I might ask, Doctor, if you could, I'd like you to say a few words. You've been doing a fantastic job in just a short time. We haven't had much time, but you've really been doing a really fantastic time. Please.
Thank you. Well, before you came in, Mr. President, we talked about which Americans are most vulnerable, and the fact that younger Americans may not be as vulnerable. So we're really focused very much in that way, and I think the airline industry can help us also in any kind of screening required, particularly to protect our older Americans.
Good. Well, thank you. Thank you. Doug, do you have anything to say?
No, thank you for having us. Thanks for the work we're doing jointly to keep people safe. We're proud of our team. We're proud of the work they're doing. We appreciate the aggressive containment efforts that the United States has done to protect Americans and the role we played in that. And so we're happy to be here and continue to be interested in anything we can do, particularly as we move from maybe aggressive containment to mitigation efforts.
Right.
What can be done there as well?
Doug is the head of American Airlines, as you know. Maybe we'll go around the room. If you'd like to say something, please.
Well, thank you, Mr. President.
Thank you.
And again, we appreciate the leadership, appreciate the collaboration and coordination, and certainly the industry wants to do everything that we can to keep Americans safe, and certainly our employees and our customers. We've stepped up our efforts to make sure the airplanes are clean and disinfected, and we work very closely with the CDC, and I think that's gone very, very well. So we've got the proper protocols in place whenever there is a suspected illness, and I think all that's working very well, where I think everybody's doing a great job and doing all they can.
We appreciate the job you're doing. Thank you very much. Please.
Brad Tildeman, Alaska Airlines, we appreciate the efforts, Mr. President. I think like all of the folks around the table, the focus of the airline leadership teams is the safety of our employees and the safety of our customers, and that's how we're focused. I think all of us have made a lot of changes to our cleaning procedures, changes to our onboard procedures, to gloves, sanitation, the service that our flight attendants are providing our customers, and we're trying to do everything we can to help everyone contain the virus and contain the spread of it. And we appreciate it. If there's more that we can do to help, we're here to tell you that we want to do that.
Are you using different things for the cleaning, the fluids? Are you using different cleaning
We've taken a
fluids?
good look at them. The stuff that we're using, I think we've concluded is effective, but we are changing the routines. And there's 3 levels of clean that we do, and we're intensifying the cleaning of the aircraft.
Thank you very much. Great job. Peter?
Peter Ingram with Hawaiian Airlines, Mr. President. I echo my counterparts in the industry talking about the safety of our guests and our employees is paramount in everything we do, and we really appreciate the collaboration with the administration and the government to make sure that we're doing everything we can to ensure that. I think it is very helpful to hear Dr. Burks talk about the specific areas
Right.
of risk, because there is a lot of concern out there. There's concern internationally about travel, and there's concern domestically, and I think the more information that we have to share with our guests about the facts is very helpful as we go forward with this challenge.
Good. Thank you very much. Thanks, Peter.
Matt Costco from Public Airways. Thank
Yes.
you, Mr. President, for this opportunity for us to come together as leaders in the aviation industry and to have a sharing of information, which I think is critical. We all represent the men and women that are on the front lines and need to ensure that they have the tools, resources, and information to do their job each and every day so that these efforts are effective. And the one thing the aviation industry has proven it does very well is it comes together in times of challenge to provide a solution for this country. So I feel very confident that with your leadership and all the folks in the room that we will continue to serve, first and foremost, our employees so they can serve the customers that depend on us.
Very good. Chad, did you have anything to say, by the way?
Well, I would just say, Mr. President, that again, at your leadership, we're funneling to 11 specific airports, and contract medical staff that we put in place have screened over 53,000 individuals and prevented a number of folks from coming into the country. And that's largely due to the cooperation and the flexibility of the individuals in this room. So again, thank you for everything that you're doing to help us keep America safe.
And Chad, anything different on the southern border where we're doing so well? We're setting records on the southern border in terms of allowing the people that are supposed to be here in, but not allowing others in. Anything new on the southern border?
Well, again, from a screening standpoint, we have some of the same measures that we do at airports of entry at our land ports of entry. So we, CBP officers and again, contract medical staff, some from HHS and some contract are, again, screening individuals and referring to CDC as necessary. So some of the same procedures at airports taking place at land ports of entry as well as maritime ports of entry. So for DHS, we're looking at every way individuals come into the country, not just through the
Right.
through the airports, making sure that we're securing the country as a whole.
Good job. Thank you.
Mr. President, thank you for having us. We were delighted when you made the Vice President the head of the Interagency Task Force. We believe in collaboration. We want to try to solve these problems, both short and long term. We've been sharing ideas with the Vice President's staff and your staff. We think there are better ways to trace the passengers coming in. We've contracted to have a mobile app and a website developed that everyone would have to fill out that would go directly to CDC with that information, and we're moving forward with that. So there's been good progress. I think what we all need is the reassurance that you and the Vice President and others have been providing that travel is safe and that we can go forward, because right now the fear is almost worse than the virus.
Yeah, they were doing a good job. These professionals are really amazing. They've really stepped up, like the airlines have stepped up, very much so. Thank you.
Mr. President, Robin Hayes, JetBlue. Thank you very much for having us today, Mr. Vice President. And a lot of it's been said, but we're taking many of the same measures as everyone else to keep our customers and our crew members, our employees safe and secure. Thank you for putting the Vice President in charge of these efforts. The federal government has tremendous capability when it comes together and is orchestrated with a common goal. And I'd just like to spend just a quick shout out to the people in the federal government and the people that work for all of us who are really in the front lines of this and the heroic efforts they're making every day to keep us safe and secure.
Thank you very much. Oscar?
I'll take a different angle, just because a lot of it's been said. I started my whole conversation earlier before you came in. The safety and health of our customers and our employees are the top one. So we will cooperate and collaborate with everything. I think as I look through this from a personal lens, I'm a heart transplant survivor. If you think of the poster child for the individual that could be affected by this, I am it. I'm older than the age, and I have immune systems, and so that's the task we take at United about making our planes safe. We're exploring all the different ideas and aspects that we can do to ensure that our planes are as safe as possible. From the ask perspective, anything that continues to project stability, calm, and Dr. Brex with regards to behavior. We've invented the Corona bump at United, where you'll see us all bumping each other. It may sound silly, but it's a fun way of expressing what I think we all need to know is be careful for the next few weeks as we control this, that we adapt our behavior so that indeed we can continue to stay safe. So thank you for everything you guys have done.
And that's right, you are a heart transplant survivor.
Yes,
I was reading about that as one of the big executives, great executives of our country, of the world, and your heart transplant, I'll tell you, you look very good to me, Oscar.
I don't recommend
You
it.
have that one down, don't recommend it, but you, that's a fantastic story. Wow, that's great, thank you very much, Oscar. Mike, why don't you finish it up?
Well, thank you, Mr. President. Again, the American people deserve to know that the threat of contracting the coronavirus remains low, according to all of our experts. But at your direction, we are going to continue to bring the full resources of the federal government, and we're going to enlist the full resources of American industry to keep the American people safe. And our airlines have been exceptional partners with us, not only the executives, but we also want to commend the crews that have been taking such good care of passengers, the people that are cleaning the planes, and keeping it all safe, and working with us on the screening process and the funneling process. And as you said, Mr. President, we're going to continue to lean into this effort, and we'll continue to do so until we find our way through the impacts of the coronavirus. And when we accomplish that, we'll accomplish it as one American people, as one team. And I'm grateful to have the people on the team here in the room.
Great job, Mike. As certain areas get to be more of a problem, we may close them up, as we have done with numerous areas. At this moment, we think we have it very much in hand. We've closed certain areas down very strongly. In some cases, not whole countries, but certain areas within countries, like in Italy. We are I think doing a very effective job in terms of that is very important. The one thing that we were discussing before is you really don't know what the percentage is. Some people will have this at a very light level and won't even go to a doctor or a hospital, they'll get better. There are many people like that. Young people seem to be, you can't say immune to it, but they're certainly, the numbers are very small. And it does affect the older people that, like the nursing home situation that we have on the West Coast, a single nursing home, where we have a pretty big percentage of people. But as things go along, so we're trying to adjust the number, we're trying to see what the number might be. But if you add, many people that have it and don't know they have it, or they think they have a cold and all of a sudden they're recovering from it, I think that number will probably be a lot different numbers than the 2s and even the 1.5s that we're hearing. And I think that's an important thing for people to know. I'm very proud of the people in the administration. I'm very proud of the airline business. You said it very well when you said the airline business always seems to pull together. And I've seen that over the years, and this is a great case of it. And I want to thank you all. You're great executives, and you love the country, and you love what you do, and thank you all very much. We appreciate it. Thank you.
Mr. President, are you considering giving any sort of financial support to the airlines to deal with that loss of business from overseas travel?
Don't ask that question, please, because they haven't asked it. So I don't want you to give them any ideas, or you'll end up heading an airline. He'll end up heading an airline. That's a pretty tough question. So I don't know. We haven't discussed that yet.
All right, thanks, guys. Thanks, guys.
What would you say to those who are flying? Is it safe to fly?
What?
Is your message that to Americans that it's safe to fly, and can you convince the traveling
Yeah, I
public
think
about
where
it?
these people are flying, it's safe to fly, and large portions of the world are very safe to fly. So we don't want to say anything other than that. And we have closed down certain sections of the world, frankly, and they've sort of automatically closed them also. And if they'll understand that, and they understand it better perhaps than anybody, yes, it's safe.
And are
Absolutely.
American businesses overreacting to cutting down domestic travel, and they're telling people not to fly to conferences inside the United
Well, a
States?
lot of people are doing a lot of domestic business now. I can tell you, they're staying in this country. They feel safe because we have if you look at a percentage, we have a very, very small percentage. And a big percentage of what we have is when we brought in the 40 or so people from the ship. We brought them in, we immediately quarantined them, but you're adding that to the numbers that we had, which were very small. Now what we're going to do is, as people get better, because we have, most of these people are getting better. Some are already released, some are going home, some are, get a full 100% report. We're going to take them off the list. But we have a very small number of people in this country. We have a big country. The biggest impact we had was when we took the 40-plus people. They're Americans. I mean, I could say, don't let them into the country, but these are Americans, and they were literally stranded. And it was very unfair. We brought them back, we immediately quarantined them, but you add that to the numbers. But if you don't add that to the numbers, we're talking about very small numbers in the United States. We've all done a very good job, all of us. And I think the news has been, for the most part, the media has really treated us very fairly, which I appreciate. I think it's very important.
When people
Yes.
get on planes, Mr. President, is there anything that they should be doing differently? Since you think it is safe to fly,
Well,
you
let
get
me
on that
ask the head of
airplane.
American Airlines or
Is there
United
anything
Airlines.
to the executives around the table that if you're a passenger, you get on that plane, we've been told, wash your hands.
Yeah, maybe
Is there
Dr.
anything
Burks.
that you have
Dr.
a
Burks
message
would be the best, and then you can maybe say something too.
Well, we're always saying the common sense of washing your hands, not touching your face, ensuring that if you've touched anything, you go and wash your hands again. 20 seconds with soap. Hand sanitizers also work, but I think I was very reassured to hear the airlines talk about their cleaning procedures and their 3 levels of cleaning procedures, because I think that will be reassuring to the American public.
And I haven't touched my face in weeks. In weeks.
Mr. President,
I miss it.
Would you do anything to address some of the concerns of maybe travelers who booked their flights and, they might be, coming up on a trip and they might have to make rearrangements? Is that
Yeah,
something?
what would you say about that?
We just issued we put out a fair sale recently that allows customers the flexibility to book their travel in advance, and if they find they want to change that later, the change fees are waived. So I think all of us are working to figure out ways to make sure there's flexibility for them.
I would think. Oscar, how would you handle that? You have a lot of people they booked, and now maybe.
Listen, this is a time unprecedented in our history that we need to be absolutely understanding of people's travel plans. And like Doug and most of the airlines, we are taking all appropriate measures to make sure that our customers get the best treatment.
I think people are going to be very impressed with what the airlines do.
Mr. President, you mentioned an Obama-era rule that you had changed regarding this virus. I didn't follow that. What,
Well, let's talk about it. Go
We
ahead.
could talk, Bob Redfield, you might speak about the last administration asserted FDA jurisdiction over testing and the development of tests like this. And Bob, President changed that on Saturday, so that now, as I spoke to several governors this morning, states now have the ability to actually conduct the coronavirus test in state labs, university laboratories.
Big difference.
And that's because of the change the President authorized. Bob, you just might
Very quickly.
reflect on the changing jurisdiction of that's freed up more available testing.
Thank you, Mr. Vice President. So in the past, we used to be able to have laboratories that could develop what we call laboratory-developed tests and then be able to apply them for clinical purposes. And in the previous administration, that became regulated. So that now, for someone to do that, they had to formally file with the FDA. And what the President's decision did was allow that regulatory relief now, and that those university labs and those other labs in this country now can be fully engaged in developing laboratory diagnostics for the clinical arena, so the men and women in this nation can get access to, and the doctors to get to know the extent of HIV and the patients that they're caring for. It's really very, very important. It's what's changed the availability of testing overnight.
It was a very big move, and it was something that we had to do, and we did it very quickly, and now we have tremendous flexibility, many, many more sites, many, many more people, and you couldn't have had that under the Obama rule, and we ended that rule very quickly. Yes?
Mr. President, on the contact tracing, can you explain what you're hoping to get from these folks? What more information do they need to track or share with the government?
Go ahead, John.
So what we're asking for is additional pieces of information so that the CDC, HHS, and others can track individuals as they come into the country and as they continue on to their final destination. And if we need to, from a health perspective, to continue to reach out, continue to track them, and to get in touch with them, looking for a few more pieces of information and data from them.
Do you think you'll get resolution in this meeting today on that?
I think we will continue to have conversations, but yes, we'll get resolution.
Can I follow up on that question? The North Carolina case was someone who was at the nursing home in Washington State. Does the administration now have the contact information who are with that person on the flight to North Carolina?
That public health evaluation is ongoing right now, and we're working with the airlines and obviously with the North Carolina Health Department. CDC supports the local public health department to really work together to get all that information that's in progress.
But at this point, you do not have that, the passenger information of people who are on that flight?
My understanding is we have the manifest. Now it's the trick is to go find them, and that's why we're having this discussion.
And much of that has been done already.
All right, thanks, guys. Let's go.
Thank you very much, everybody.
Thanks, guys.
Thank you.
Let's go.
Can't believe it. No questions on the
thank you.
election. This has to be good.
All right, thanks, guys. Let's go. Let's go. Come on, guys. Jennifer, let's go.
Last night, you invited us, Mr. President. What did you think about
Well,
last night?
I think the election was great last night. I thought it was great. I thought the results were, it was a great comeback for Joe Biden. Incredible comeback when you think about it. But if you would have looked, if Elizabeth Warren would have done what she probably should have done from their point of view, he would have won, right? He would have won a lot of states, including Massachusetts, probably Texas, definitely Minnesota. So Bernie would have won states that he lost, and he lost fairly easily. But in particular, Massachusetts, I would say Minnesota in particular. I would also say Texas and some others. So had she, I put something out on it this morning, she was really a spoiler because other people got out and those votes inured to Joe. And those people really helped Joe, you know, by getting out early, by the couple that got out and did the endorsement. In the case of Elizabeth Warren, had she gotten out, it would have been a very different situation, I think. It would have been a very different night. Just that one simple move. Had she left, you pick up Massachusetts, Minnesota, and probably Texas. And those are the three I checked. I would imagine there are others that he would have picked up too. So Elizabeth Warren was the single biggest factor in that election last night. It would have been a very different thing, and not in a positive way for her, in a very selfish way for her. She was very selfish from that point of view. Now, do I care? No, because we're just waiting to find out who we're running against. But when you look at it, pretty incredible. If she would have gotten out and endorsed, even if she didn't even have to endorse. I think there's a lot of bad blood there. But had she gotten out and endorsed, he would have been a lot better off.
What do you think happens now?
Well, now I think it's a very tough, I think it's tough. I think Joe has an easier path right now, believe it or not. I see Mini Mike just got out, and he's going to, try and save face by putting some money into Biden's campaign. And we'll see what happens. I don't think that's going to have an impact. You got to look, money has to be spent wisely. One thing this whole thing has shown, that you can't buy an election. It's a beautiful thing. Steyer put in $250, $300 million, and now who knows where he is. He's home probably licking his wounds. And Bloomberg put in probably $1 billion. And, sometimes you just don't have what it takes. And I said to him, it's not easy doing what I did, is it? So it's one of those things, but it's going to be very interesting to think that this would have changed so much, because if you go before Saturday, before South Carolina, I mean, Joe had absolutely no chance, according to you people. But they used to say that about me too, not as much though. I think, I always felt I had a very good chance, but I'd watch and they'd say, well, can't happen, but it happened, and it happened pretty easily. I think now I think Joe actually would have the advantage now. If you look at the states he's going to, with Florida and others, I think he's got an advantage in those states. But again, had Elizabeth Warren endorsed Bernie, you're talking about a whole different subject. And that's not even a question. You're talking about because he would have gotten 80, 90, almost, he would have gotten most of those votes. So you're talking about a much different thing.
What do you make of the stock market's reaction today? It seems like there's been a sigh of relief that
I think
now
there
that
is.
Biden
I think,
has the
well, I've said
delegate
from the
Sanders.
beginning, it's partially this. It's a big part this, but it's also the fact that they didn't like seeing what they're seeing. But they don't like Joe either. Joe's become, a lot of people are with Joe. If you look at those people, they're worse than Bernie in terms of being radical left. Some of Joe's handlers, and that's what they are, is handlers. I want to be nice, but they are handlers. Some of Joe's handlers are further left than Bernie. That's pretty scary. So it's going to be that way, yeah.
Do you think Bloomberg's money will be more powerful without Bloomberg himself in the race? And he said he's going to.
Well, it couldn't be less powerful, because look what $1 billion did. He won nothing. He got so few delegates. It's incredible. I would say probably, well, I know now he's doing that because, he's spiteful, and he's a spiteful guy. I know him well. He's a very spiteful guy. He's very upset. He made a fool out of himself, to be honest with you, and he's not too happy about that. I think the first thing he should do is fire his political consultants, because I know him. I could have told him very easily, you can't win. You can put $2 billion in, you can't win. Okay, thank you, everybody.
All right, thanks, guys. Let's go.
Right this way, guys.
Come on,
Thank you.
let's go. Thank you. We're done. Let's go.
Well, thank you all for being here. At the President's direction, we have initiated, since the advent of the coronavirus here in the United States, a whole-of-government approach. President Trump took unprecedented action when he suspended all travel from China, quarantined Americans that were returning. We've issued recent travel advisories for affected areas in Italy and South Korea, and initiated screening of all passengers from all airports at either one of those countries coming into the United States of America. We're doing everything in our power to prevent the coronavirus from further coming to the United States, but we're also working every bit as hard to mitigate the spread of the coronavirus in this country. We all grieve the loss of American lives. Word this morning from the CDC is that one more American has expired, and their family has our condolences. 10 Americans have succumbed to this disease, and now we have a little more than 100 Americans who have contracted the coronavirus. We'll continue to bring the full resources of HHS, the CDC, and every agency of this government to address this crisis. But as President Trump also directed us, not just a whole-of-government approach, but a whole-of-America approach. Earlier today, given the fact increasingly aware of the unique vulnerability of our senior citizens, we met with nursing home leaders in this room. And today our administration announced increased standards for all nursing homes in the United States of America to prevent the spread of infectious diseases. And later today we'll be implementing a new policy to focus all of our inspection efforts in all 50 states on nursing homes complying with infectious disease protocols that have been put into place by the federal government. We met, as you all are aware, with airlines. Given the advisories that have been issued around the world, the role that airlines have played in funneling and in screening personnel, it's been a strong collaboration and will continue to be a strong collaboration with our airlines following the President's meeting with those executives today. But obviously of greatest concern to many millions of Americans is the issue of testing. President Trump took decisive action this weekend when he changed the way that testing is approved through the FDA. Now I'm pleased to report that we have more than 2,500 kits that are being distributed around the country this week that'll make more than 1.5 million tests available at hospitals that have requested them and in areas of the country that have been particularly impacted by the coronavirus. In addition to that, as I've spoken with many governors, we've also approved a process for testing that can be conducted at state laboratories anywhere in the United States of America, and also at university laboratories, and that's now available. But as Dr. Birx and I discussed, and the Secretary and I discussed, our objective is to make tests available broadly to the American public. We want to make sure the American people can go to their doctor, can go to the local MedCheck or CVS and obtain access to coronavirus. In fact, yesterday the administration just recently changed the guidance from CDC that any American that wants to be tested for the coronavirus on their doctor's indications can be tested. Now, meeting that need is the reason we have this meeting today. I'm glad to be surrounded by CEOs of the nation's leading commercial laboratories who have immense capacity to do testing and to facilitate this effort. And I want to thank those that are gathered around the table for being here and for informing me just a few short minutes ago that in cooperation with our administration, with some changes with the FDA rules that are going forward, that they have formed a consortium in this industry to share information and to speed the availability of tests to the broader American public. We are going to focus the availability of testing in the areas that have been most impacted, communities where we have coronavirus cases. And for my part, after I traveled to Minnesota to visit 3M, that is a leading manufacturer of surgical and healthcare masks, we're also announcing today that I'll be traveling to Olympia in Washington State meeting with Governor Jay Inslee. We'll be taking our entire team there with an effort to really continue to support Governor Inslee's efforts to focus resources on the community in the Seattle area and in California that's been uniquely impacted by the coronavirus. But on behalf of the President, let me just say how grateful we are to each and every one of you for the swift and collaborative and frankly, distinctly American way that you've approached this issue. This is a powerful industry, and we know, working with you, that literally we can make thousands of tests available within a week to the American public, and literally millions of tests available in the weeks ahead. But it's going to take all of us to do it, and I can pledge to you that you'll have the full cooperation of the HHS, our entire task force team, and the FDA, so that the American public can know that they will soon very broadly have access to testing across this country. But in the immediate, the public should know that we are speeding tests, and now tests are available in state laboratories and university laboratories in every state in this country. So we'll continue to lean into this, but let me thank Adam Schechter and invite you to make a few comments about LabCorp's role, and thank you for putting this consortium together. We're grateful for the leadership of everyone at this table.
Thank you, Mr. Vice President, and we appreciate you convening this very important meeting. We represent the national, the regional, local, but also the academic institution laboratories. And we've decided to come together as one to help really focus on this important health crisis. So we will be sharing information, we'll be working together on capacity, and we'll be doing everything we can across our industry to meet the needs of the American people. Where we stand today at LabCorp, we are in final validation of our own laboratory test. We would expect to launch that at the end of this week or the beginning of next week, and we'll begin to have that available for physicians to utilize around the country throughout next week. I'll turn it over to my colleague, Steve, from Quest Diagnostics.
Thanks, Steve.
Yeah, thanks, Mr. Vice President. Appreciate the opportunity and your leadership in this matter. We understand this is a public health issue that we all have a role in, and we're deeply committed to working through this together. We also appreciate the support of the FDA and the Center for Disease Control. They've been very good partners in this regard, and particularly over the weekend. The decision that was made to give us a decision that accelerated our path to bringing tests to the marketplace. As Adam said, we're validating it as we speak, and hopefully by the next week we'll be able to ramp that up in a number of our laboratories throughout this country. So we're all in, we're here to help, and we believe we have some capabilities to manage this in a very proactive way.
Thank you, Steve, very much. And Mark Casper with Thermo Fisher.
Mr. Vice President, thank you. It's been an incredible collaboration with the CDC, the National Institutes of Health, the FDA, and with Secretary Azar to put ourselves in a position as a manufacturer of the diagnostic test kits that would be used in the laboratory, that we will be shipping kits starting next week and working with the FDA to get the various additional approvals so that we can ramp up and have millions of tests available per week should they be needed by our health system across the country.
Let me emphasize again, and I'm going to recognize Dr. Birx for her reflections on this group, about the importance of this consortium being formed and the availability of these tests. The risk to the American public of contracting the coronavirus remains low. But at the President's direction, we are bringing the full resources, not just of the American government, but the American economy, to make sure that in our meeting with the pharmaceutical companies that we're developing vaccines, which may not be available for another year or a year and a half, but we're also developing therapeutics that we believe could be available in fairly short order for people that are struggling with coronavirus. But beyond that, we want every American, as soon as possible, to have access to testing. But people should know that today, thanks to the changes that the President directed through the FDA, that state laboratories, university laboratories can conduct testing. The HHS has made sure that 2,500 kits have been distributed. 1.5 million tests are arriving at hospitals around the country, especially in areas that have been impacted by coronavirus. But we do believe this consortium can make, in a matter of weeks, not months, a test for the American people more widely available across the country. And we're going to work very energetically and around the clock with each one of you in cooperation to make that possible. But Dr. Birx, maybe you might share about the significance of this, and then I'll ask the Secretary, and we'll take a question or two.
Thank you, Mr. President and Mr. Vice President. What has been really helpful in these discussions is understanding that obviously diagnostics is the gateway, both for prevention and ensuring that they can provide prevention interventions as well as treatment. And so this is really why we have assembled. We've had meetings about treatment, about vaccines and prevention, but making sure that every American family understands if they have someone in the household that is positive, what preventive medicines we can take right now to ensure that that virus is not transmitted to others. You have to have that information in order to be proactive and have that understanding. This group can solve this issue for the general practitioner out there and for the minute clinics and other available outlets. And so while we work within the healthcare delivery system, we want to make sure that we're covering every single aspect of where the American people seek their healthcare. And I've been so impressed in just 3 days of them. As soon as a barrier comes up, the administration immediately addresses that, understanding that that gets us to the result and the goals quicker. And it's just been a privilege to be here the last 3 days.
Thank you, Dr. Birx.
All right, thanks, guys. Thank you.
I said a question or two. Go ahead.
You said, Mr. Vice President, that you'd be going to Washington. Can you tell us what the goal of that trip is, and is that tomorrow?
We'll be traveling tomorrow. I'll be visiting Minnesota, visiting 3M. We're working with them, working with members of Congress to pass a supplemental bill to see to the manufacture of literally tens of millions of masks for our healthcare workers. It's very important to say that our medical experts have made it clear the American people don't need to buy masks, but we want to make sure that people that are caring for the American public have the proper protective gear, masks and gloves and goggles to be able to be safe as they administer their care. Then we'll be traveling on to Washington State. I'll be in Olympia. We'll be meeting with Governor Jay Inslee, and we'll be bringing our team with us to further coordinate and ensure that we are giving all support necessary to Washington State's efforts there. I will tell you, having spoken to Governor Inslee yesterday, we continue to be very grateful and very impressed with Washington State's efforts. But by being there on the ground, I want to assure the people of Washington State, people of California, people that are in the communities that are being impacted by the coronavirus, that we're with them. We're going to ensure that the full resources the federal government are brought to bear on those that are struggling with this illness, and also supporting the community and the efforts to determine the nature and exactly how widespread the coronavirus might be at this point.
Mr. Vice President, obviously there are efforts to expand testing and to expand the number of kits, but there have been criticisms that this may be too little too late. What do you say to those who say this should have been done far sooner?
Mr. Secretary, you want to address that?
Yes. So first, I want to express on behalf of our country the immense gratitude that we need to have to Dr. Robert Redfield and the CDC and to Dr. Steve Hahn and the FDA for the unbelievably fast work that is leading to 1 million tests being available by the end of the week in this country. And these are validated tests. These are quality American regulated tests that are available because of the work of these agencies. We also, at the President and Vice President's direction, are, as usual, leading the rest of the world in diagnostic testing. There was a great article in the Wall Street Journal today I would encourage you to look at that actually discusses how America's practices on testing here are equal to or ahead of what the other major countries are. Remember, we only have over 100 cases so far in the United States. We are not South Korea. South Korea may be doing tens of thousands of tests because South Korea is in a very different epidemiological position. It is more like China's situation than like the United States or Canada's situation. But now, thanks to this leadership, before we are at that point, we will have in the field millions of diagnostics over the next several weeks ready for this challenge because of the President and Vice President's firm international leadership.
Thank you, Mr. Secretary.
Mr. President, Congress has reached a bipartisan agreement on a multi-billion-dollar package. Can you address that? It's much more than the original amount that the administration had proposed. Is the administration prepared to support this? I mean, can you provide a comment on that, please?
Well, we've been working very closely with members of Congress in both political parties. Very shortly, I'll be back on Capitol Hill, bringing our team to meet with the Republican and Democrat caucuses in the House of Representatives. We had a very productive meeting yesterday in the Senate with Republican and Democrat members. As the President said so well, we're all in this together. Our administration has taken the approach to listen to members of Congress, we're listening to governors, and we're absolutely committed to ensure that not only do all the federal agencies that are dealing with the coronavirus have the resources they need, but we're going to make sure that states, local health officials have their resources, and frankly, all of our private partners can be confident that as they make investments in this space, that there'll be the compensation for that. HHS has already denominated a test for the coronavirus to be an essential health benefit, which ensures that it will be covered by people's private health insurance, it'll be covered by Medicare and Medicaid, and we'll continue to work in that way. But we look forward to seeing the details, but I can assure you the White House legislative team has been working in a very collaborative, very cooperative way with members of Congress, and we look forward to them completing their work on this important supplemental within the next 10 days.
All right, thanks, guys. Let's go. Thank you, guys. Let's go. Come on, guys. Let's go.
Thank you.
Thank you, Mr. Vice President.